that question to you, Bennett. What's your experience of the NHS and how would you reform it?
I mean, the problem, I'd love to be able to give you just a sort of a headline, just a snapshot of what I do, but the problem is, because it is so vast, so bloated, and there are so many issues, there is no one sort of solution to it. And therein, I think, is where I'd probably start. I'd probably try to streamline a lot more of it. I'd try to sort of reduce down the size of the entire edifice, because actually, in terms of the managerial aspect, in terms of all sorts of bits of it, it doesn't need to be this large. And it is, like, this is an affliction, actually, that affects many aspects of the British state. It's not unique to the NHS. It's just that the NHS swallows everything else by comparison, is that a function of the state has just expanded its remit without improving output, effectively just to cocoon itself, to protect itself, so it is insulated
it's
from
like
the winds
black
of
hole
change.
sucking in
Basically,
funding.
the greater the remit, the more untouchable it is, basically. And that is why it has become increasingly difficult to even talk about reform, until it gets to the point, of course, at which systems literally start breaking down.
But isn't it absolutely fascinating, the change we've had from many of the mainstream media, the NHS. Clapping, no, I wasn't. We were clapping for carers. We were clapping for people working on the front line.
Which is another thing that needs to be affected to help the NHS.
But this is there's different things. But this whole sort of the envy of the world, NHS, isn't it wonderful? It's wonderful. And then suddenly, oh no, it's not. Oh no, now it needs reform. Again, I'm telling you that I just think that if this was a Tory government saying all this right now, this report, there would be completely different coverage of this. I'm waiting to see what the British Medical Association, the totally ideologically captured BMA, the doctors' representatives, what they're going to do, because and apparently, Lord Darzi, he's had an awful lot of input from Royal Colleges and NHS trust managers, a lot of people, and the man knows how the NHS works. He's worked in the NHS for years. But I just wonder, when you actually start saying we're going to need people to be doing more stuff and doing it better. I think a lot of people working in the public sector, there'll be a lot of people in the NHS who go, hallelujah. But there'll also be a lot of people going, what do you mean you want me to do more? And also, you know what, maybe we don't need as many paper pushers.
I think if you were to, the thing is, the BMA, unions tend to be overly powerful in sort of, as opposed to the entirety of the profession that they tend to represent. And we know this by the fact that they're able to strike with sort of not necessarily a majority in some cases. I think if you were to talk to a lot of NHS professionals, actually, they would sort of very sotto voce say, no, actually, it does need very serious reform, but it is very quiet and on an individual basis, because they fear the sort of the ostracising of the majority.
People who, the amount of people who were getting in touch with me, and I was checking their credentials, they were genuine people, they weren't, pretending, who were working in senior levels at the NHS. I'm talking about chief executives, I'm talking about people running A&E units, who was talking to me when we were battling against COVID lockdowns and various policies, who were absolutely tearing their hair out at the insanity of a lot of the policies, which have led to a lot of the problems we've got right now. But again, no one's listening. And if you did speak out, you were threatened with the sack. Well,
exactly. The whistleblowers are always the people that are sort of targeted, and it does.
Even if you're talking about someone you think is murdering babies.
Exactly. I don't want to sort of just go down the sort of everything's the Soviet Union route, but it does remind you of the Soviet system in its sort of last decade, where everybody knew the system wasn't working, but you couldn't say anything because then you get the tap on the shoulder. Ultimately, if we are going to reform the NHS, if you want to keep it in its current model, as much as anything else, you will need to change that culture first and foremost, where if somebody says there is a problem that could lead to a lot of people dying, you're not the person ostracised. Instead, you
should be rewarded for that and probably promoted for saying something. And something needs to be done. I've always said, genuinely, you could go around you did it anonymously to say, look, here's a box, just put your ideas. How can we save money? How can we improve things? I'm telling you that, the nurses on the wards, the porters, the hospital doctors, they would be able to tell you ways you could save billions immediately and you could push more patients through the system quicker. Let's go through some of the stats, because these are extraordinary. Okay, this blows my mind. The NHS basically does less with more cash. That's basically, they're doing less. They've got more money. £165 billion record funding. By the way, for those who are still worrying about that big vote we had in 2016 and that big red bus, we could spend £350 million more on the NHS. Yeah, we're spending way more than that a week on the NHS, and we still ain't getting better services. Now, NHS surgeries, they're down 15%. The number of surgeries down compared to a few years ago. The number of outpatient appointments per consultant, down 10%. The number of clinicians per bed is up 13%. The number of A&E patients seen by clinicians is down 23%. Hospital staff up 17% since 2019. Productivity down 11% since 2019. Lord Darzi reckons, and this is a well-established fact, that some 14,000 people are dying extra every year because of A&E waits. Literally, so they get to A&E, they're either in the ambulance outside in the bay, or they're on a hospital corridor trolley, and they're literally dying because they're not getting seen quick enough. I mean, it is that blatant. There's been no progress whatsoever. That's Lord Darzi's words. No progress whatsoever in cancer diagnosis between 2013 and 2021. If you've got cancer and you live here, you are more likely to die than if you live in France or most Eastern European countries.
Yeah.
Now, that is pretty telling. It's not just, well, those countries have these wonderful healthcare systems. They've been paying more in for years and years. You're talking about countries that are a lot poorer than ours that have better outcomes. The one thing all these other countries have in common is they don't have an NHS. What they do have, mostly, is these systems where basically it's a sort of social insurance policy. Basically, you pay an insurance policy for your healthcare, and you get that. But everybody, no matter how poor you are, they are covered. The government basically pays for the people who can't afford it or tops up the people who can't afford any more. So everyone gets it. But it does mean that people are more careful about using the healthcare service, but they also expect more, and it means there's competition.
Exactly.
But it's not the American system, which is a disaster.
Yeah. Although the American system, it must be said, as much as it is a disaster, it does pay for a lot of the revolutionary treatments that the rest of the world ends up using.
If you're rich, America is where you want to be.
That's the trade-off, basically, with the US system. You will get cutting-edge surgery and treatments
if you've got
that no one
a
else
spare
will.
$250,000.
Exactly. So, and then you have the flip side, which is the NHS, where everybody pays into it via their tax system. There is no motivation, there is no competition. You are protected if you're working in it, basically, based on performance. And the NHS turns around to you and goes, we can't afford the life-saving surgery, we can't afford the groundbreaking treatment, you'll just have to lump it with everybody else. And then, of course, as you say, you get most of the rest of the developed world, which is somewhere in the middle, where there is a degree of competition, but also the state props you up, and it does work. And actually, the irony of this, of course, you were talking about Eastern European countries, a lot of their doctors are working in the NHS. It's not as if they've got massive overproduction and they're all well stuffed. They go to other countries as well, and yet they're still doing better.
Absolutely.
And something else that we do need to look at, I'm sorry, it doesn't get talked about enough. As you said, the number of clinicians per bed has gone up, but performances have gone down. Why is that? We need to be looking at, because we're not recruiting enough in this country, where are these clinicians coming from? Who is training them? What are their credentials? What is their motivation? Is English even their first language? Very often it isn't. This is a very real part of the issue. This is a very real part. Again, I told a story before with my husband when he had an operation, and we were given instructions about what to do with the bandages and the treatment. And it was very specific about, when they had to come off, when what you had to look for if there was a problem and you had to return, and we couldn't understand a word that the nurse was saying. I'm genuine, and I very politely said to her, I'm so sorry, I can't actually understand. Could you speak more slowly? Could you write it down? Could you? And we basically had to give up. We had to give up. It was just no point. And a very, very strong West African accent, a very, very, very strong accent. And clearly English is second language. She was a very good nurse, but I couldn't understand him. I'm thinking the patient being able to understand the nurse was quite crucial. It's crucial. And the other nurses, I don't think could understand, judging by the conversations we saw. So they couldn't communicate. I'm sorry. Someone's going to die as a result of that. It's insane. A lot of people have died. Actually, if you look at the numbers of doctors who are taken up on issues of medical malpractice or clinical error, who are struck off in this country, it is disproportionately
I believe it's 75%.
Yeah, disproportionately, massively disproportionately doctors and nurses who were not born in this country, did not train in this country, and we all know why they're being brought in. And we also have to say, it is immoral. It is immoral to be taking... There are more Ghanaian nurses in the UK than there are in Ghana today. That's not acceptable. That tells you something, indeed. Look, there's loads more I want to talk about this. I want to hear from you. What's your experience of the NHS? How would you reform it, crucially? What would you do differently? I've got a million ideas as an NHS GP's daughter, I have to say. Tell you what I would have, first of all. GPs working full-time. If you want to be a GP, brilliant. Loads of years of training. That's right. I'm very happy for you to be highly paid. It's highly skilled work. We want our brightest and our best to go and work in the medical profession. You need to work a full week. You can't do the job. If you want a part-time job, you need to go into another career. That's what I would say. That's my number one. Can we all work? That's a job you have to do full-time. I don't mind a little bit of part-time when your kids are maybe, up to 3 or whatever. Fair enough. But after that point, maybe it's not the job for you.
Sorry, I'm going to put that one out there. And I mean, you know, let's just say that. So that's what I think. What do you think? 0344 499 1000 is the number to call. I just want to get to another couple of stories before we go to a break. Keir Starmer, he's speaking right now, and we'll give you some, if he says anything new or interesting, we'll let you know. But 4 million pensioners living alone, largely women, by the way, largely widows who've lost their husbands, face a fresh tax raid, we're being told, after Labour scrapped their winter fuel allowance, which has hit many of the poorer pensioners, but also both Downing Street officials and the PM yesterday refused to rule out scrapping this 25% discount for people who live alone on their council tax. Retirees make up about half the 8.5 million people who'd be affected by this. Despite the fact, I mean, the thing is, I never understood why people had such an issue with the poll tax. I've got to be honest with you. I really didn't. More of you in the household, you're using more services. Yeah. I don't see why a family of 6 or 4 or 3, I'm a family of 3, why we should pay the same council tax, pay this exactly the same as someone who's living alone. It seems to me that, you know, that's a bit crazy. But that's what they're looking at. Yet again, it will be, you know, some of them, you know, it's elderly and vulnerable families who are going to be hit. And it's not even well, you live in a mansion, you should pay more council tax. Someone living in a 1-bedroom flat would be paying more council tax, even though it wasn't their choice to live alone. Their husband died.
Yeah, I think that what you can see is quite a cynical approach to politics now, which is the very methodical targeting of a cohort that, to be fair, as a general cohort, does have a much greater proportion of the accumulated wealth in this country, and there is therefore a perception from younger voters who tend to be more Labour voters.
I'm really sorry some of them bought their houses.
I know,
you know?
I know.
How horrible, aren't they?
But this is the way that the Labour Party is going to calculate this. These people are A, not more likely to vote Labour in the future, and B, not going to be around that long anyway. It might sound very cynical, but that is the way that they do. I do. And I'm not saying that
the thing is, they've also got children who might have voted Labour who probably might not after this.
Well, this is, I suppose, the gamble that you're taking, really, is that you don't end up alienating people that much. But I do think it's very noticeable. As you know, as you pointed out, you talked about the poll tax. That was Thatcher. You know, Margaret Thatcher took people's milk away, and people
I was delighted by that.
However,
Thatcher milk snatcher.
Yeah, right now.
The milk. Does anyone else remember those horrible little quarter pints of milk that they left out in the crate in the sun, and it was warm? You're not old enough to remember this. I like fat-free milk.
What third world country did you grow up in?
It was literally it was warm. Birmingham. It was occasionally warm in. This is in Birmingham in the 1970s, and half of it would be cream, and it'd be warm, and the birds would be pecking at it.
Suddenly,
it was genuinely, it was the most disgusting thing, and you were forced to drink this warm, disgusting clotted milk.
It's like I finally get you. The childhood trauma, I get it.
The childhood trauma
all of it, I get it. But anyway, that's not what's happening. Instead, pensioners are actually going to be suffering as a result of this. But it doesn't rhyme very well, murderer with Starmer, so it's not going to catch on like Milk Snatcher did with Thatcher. I don't know.
OK, right. Well, anyway, look, there's so much more I want to talk about, including all those former prisoners who've just been let out, one of whom has been basically arrested immediately for crimes that he's been accused of that happened, obviously, before he went to prison. But I wonder how many are actually going to end up back in prison within days, weeks, months. Well, of course, they'll have to go through a very long process, the justice system. Of course, they may not actually get to court for 3 or 4 years, or probably won't be arrested because there's nowhere to put them, as we've already established. We'll talk about all of that and why Sadiq Khan, the London mayor, has suggested yesterday that prisoners who've just left jail should be given a priority on the housing list because they need somewhere to live. Yeah, I mean, where do we even start, people?